The Dangerous Drugs Board or the DDB is the government agency in the Philippines responsible for formulating policies, strategies, and programs related to the prevention and control of dangerous drugs. It serves as the central authority that coordinates the efforts of different government agencies involved in drug prevention, education, enforcement, treatment, and rehabilitation. The DDB develops national plans and guidelines to ensure a unified and effective approach in addressing the country's drug problem. It also conducts research, information campaigns, and community-based programs to raise public awareness about the harmful effects of illegal drug use. While the DDB focuses on policy making and program development, the Philippine Drug Enforcement Agency or the PDEA acts as its implementing arms, enforcing the laws and regulations related to dangerous drugs. Overall, the DDB plays a crucial role in promoting a safe, healthy, and drugs-free society.
History of DDB. The Dangerous Drugs Board or DDB was established in the Philippines on November 14, 1972 through Republic Act No. 6425, also known as the Dangerous Drugs Act of 1972. It was created under the administration of President Ferdinand E. Marcos to serve as the policy-making and coordinating body in the government's campaign against illegal drugs. The creation of the DDB marked the beginning of a more organized and comprehensive national effort to address the growing problem of drug abuse and trafficking in the country. Originally, the DDB was composed of 7 members, representing different government agencies such as the Department of Health or DOH, Department of Justice or DOJ, Department of National Defense or DND, Department of Education or DepEd, and other concerned offices. Over the years, its compositions and function were expanded and strengthened through Republic Act No. 9165 or the Comprehensive Act Dangerous Drugs Act of 2002, which remains the main law governing drug policy in the Philippines today. Under this law, the Philippine Drug Enforcement Agency or PDEA was also created as the implementing arm of the DDB. Since its establishment, the DDB has been at the forefront of formulating national policies, strategies, and programs to combat illegal drugs through prevention, education, treatment, rehabilitation, and law enforcement coordination. Its work reflects the Philippine government's long-standing commitment to building a drug-free and healthy society.
Legal basis and mandates. The legal basis and mandates of the Dangerous Drugs Board or DDB are primarily founded in Republic Act No. 9165, also known as the Comprehensive Dangerous Drugs Act of 2002. This law has recognized and strengthened the DDB, which was originally created under the Republic Act No. 6425, the Dangerous Drugs Act of 1972. Legal basis. Number 1. Republic Act No. 6425, the Dangerous Drugs Act of 1972. This law established the Dangerous Drugs Board as the policy-making and coordinating body on all matters pertaining to drug prevention and control in the Philippines. It was enacted during the administration of President Ferdinand E. Marcos on November 14, 1972. Number 2, the Republic Act No. 9165, the Comprehensive Dangerous Drugs Act of 2002. Enacted on June 7, 2002, under President Gloria Macapagal Arroyo, this law repealed RA 6425 and further strengthened the DDB's power and responsibilities. It also created the Philippine Drug Enforcement Agency or the PDEA as the implementing arm of the DDB. RA 9165 serves as the main legal framework for the country's anti-drug policies and programs. Mandates of the Dangerous Drugs Board or the DDB. Number 1. Under RA 9165, the DDB is mandated to formulate policies and programs on drug prevention and control for the whole country. Number 2. develop and adopt a comprehensive, integrated, and balanced national drug abuse prevention and control strategy. Number 3. Conduct research studies and surveys on the nature, extent, and pattern of the drug abuse in the Philippines. Number 4. Promote information, education, and advocacy programs on the ill effects of dangerous drugs. Number 5. Regulate and control the legitimate use of dangerous drugs and control precursors and essential chemicals. Number 6. Oversee treatment and rehabilitation programs for the drug dependents, including the accreditation of rehabilitation centers. Number 7. Coordinate the efforts of all government agencies, private organizations, and international bodies involved in drug abuse prevention and control. Number 8. Recommend measures and legislation to strengthen drug abuse prevention and enforcement. Number 9. Ensure proper monitoring and evaluation of the National Drug Control Program's implementation.
Composition of Dangerous Drug Board. Under Republic Act No. 9165, the Comprehensive Dangerous Drug Act of 2002, the DDB is composed of 17 members divided into permanent and ex officio members, representing different government departments and private sector. Number 1. Permanent members. These members serve full-time and are directly involved in the day-to-day policy formulation and coordination of the board. Chairperson, appointed by the President of the Philippines. 2 regular members, also appointed by the President with expertise in fields such as law enforcement, education, medicine, or social work. Number 2. Ex officio members. These members represent key government agencies that play vital role in the national anti-drug campaign. They include the heads or duly authorized representative of the following departments and offices. Number 1. Department of Justice. Number 2. Department of Health. Number 3. Department of the Interior and Local Government. Number 4. Department of Education. Number 5. Department of Social Welfare and Development. Number 6. Department of Foreign Affairs. Number 7. Department of Finance. Number 8. Department of Labor and Employment. Number 9. Department of National Defense. Number 10. Department of Transportation. Number 11. Department of Trade and Industry. Number 12. Commission of Higher Education. Number 13. National Youth Commission. And number 14. Philippines Drug Enforcement Agency. Supporting structures. The DDB operates through several technical divisions and committees such as first is Policy, Research, and Statistics Division. Conducts studies and develop policy recommendations. The next is Preventive Education, Training, and Information Division. Implements advocacy and awareness program. Next, Legal Affairs Division. Handle legal concern and assist in policy review. Next is Treatment and Rehabilitation Division. Oversees accreditation and monitoring of rehabilitation center. The last one is Administrative and Financial Management Service. Manage personnel, logistics, and budgeting.
Core functions of the Dangerous Drugs Board, or DDB. First, policy formulation and coordination. The DDB formulates and adopts national policies, plans, and strategies for the prevention and control of dangerous drugs. It coordinates the efforts of all government agencies, non-government organizations, and international bodies involved in anti-drug activities to ensure a unified and consistent national approach. Second, drug prevention and education. It develops and implements educational and information programs to raise public awareness about the harmful effects of drug abuse. The DDB works closely with schools, communities, and media to promote drug-free lifestyles and preventive education. Third, treatment and rehabilitation. The board oversees and regulates treatment and rehabilitation programs for drug dependents. It also accredits and monitors rehabilitation centers to ensure they meet national standards of care and effectiveness. Fourth, research and policy development. The DDB conducts research, studies, and surveys to understand the extent, nature, and causes of drug abuse in the country. The results of these studies are used to formulate evidence-based policies and programs. Fifth, regulation and control of dangerous drugs and chemicals. It regulates the legitimate use, manufacture, distribution, and importation of dangerous drugs and controlled precursors and essential chemicals. The DDB sets guidelines and procedures to prevent their diversion for illegal purposes. 6. Interagency coordination and monitoring. The DDB coordinates with law enforcement, health, education, and social welfare agencies to ensure the effective implementation of anti-drug policies. It monitors and evaluates the performance of these agencies to maintain accountability and efficiency. 7. International cooperation. The DDB represents the Philippine government in international conferences and organizations related to drug control. It fosters cooperation with other countries and global agencies like United Nations Office on Drug and Crime to strengthen anti-drug efforts. 8. Community mobilization and advocacy. The board promotes community-based prevention programs and encourages public participation in the fight against illegal drugs. It supports local government units or LGUs in implementing grassroots level initiatives for drug prevention and rehabilitation.
Interagency collaboration framework. The DDB coordinates with PDEA for the enforcement of drug laws and operations, DILG and LGUs for the creation and supervision of ADACs and BADACs, the DOG, DSWD, CHED and DepEd for the prevention, education, and rehabilitation, the PNP, AFP, NBI for intelligence and operations support, the civil society and NGOs for advocacy and community-based rehabilitation. This ensures an integrated system addressing both supply and demand reduction. So here is the visual mapping for the DDB coordination structure. The DDB sits at the top center of the anti-drug governance network. Under it are the four major functional clusters. For policy and governance, we have the DILG, DOG, and DOLE. For the enforcement and intelligence, we have the PDEA, PNP, AFP, and NBI. For the prevention and education, we have the DepEd, CHED, and NGOs. For treatment and rehabilitation, we have DOH, DSWD, and LGU.
Local government and BADAC rules. Local implementation happens through anti-drug abuse councils or ADACs and barangay anti-drug abuse councils or BADACs. BADAC responsibilities. They conduct community awareness activities, support rehabilitation through referral systems, collect and report drug-related data. The LG monitors council's functionality and reports to Gender's Drug Board. Coordination challenges. Overlapping mandates between PDEA and PNP cause operation confusion. Information sales limit, data exchange between agencies, budget and manpower gaps, affects LGU Council's effectiveness. Changing political leadership disrupts long-term programs. Public misconceptions about drug users hinder rehabilitation efforts. Best practices and innovations. Dangerous Drug Board Resolution Number 4 of 2021. Institutionalizations of barangay drug clearing programs. Balay Silingang Centers focus on rehabilitation and livelihood for reformists. Community-based drug rehabilitation programs or CBDRP. Integration of DOH, SWD, and LGUs. Digital ADAC Functionality Monitoring Systems or DALG tracks compliance and progress.
The Dangerous Drug Boards or DDB is the Philippine policy-making body on drug prevention and control. It formulates national policies, conducts research and education, and oversees programs for prevention, treatment, and rehabilitation of drug dependents. The DDB also regulates the legal use of dangerous drugs and works with Philippine Drug Enforcement Agency or PDEA to enforce anti-drug laws aiming to promote a drug-free and healthy society.